Can a concussion make you tired? Yes. Concussion, what it actually is in the acute phases, is an energy deficit. So you have a concussion, it creates this what they call a neurometabolic cascade of events that starts happening. So you get depolarization of neurons, you get an ion exchange, and you get calcium flooding into the cell. When calcium comes into the cell, it disrupts the mitochondria's ability to create ATP. So ATP is our energy molecule. So what happens after the initial injury happens, you have two phases. You have the excitatory phase, which is a very short duration thing, maybe 30 seconds to a minute to 5 minutes, very short duration. And then people generally start to go, okay, no, I think I'm okay, I feel better. And then over the next few hours to days, they start to go downhill. And the reason is because of that energy deficit that starts to occur after the injury. And generally, if you've been around anybody with a concussion before, you'll notice that they become very tired, irritable, sleepy, want to go to bed, and that's because that energy level just starts falling. And that's a reason why concussion can make you very fatigued in the acute stages, is because you're burning more energy than you're creating, and your body just wants to go into sleep mode. So that's in the acute phase. Now, for those patients that have had symptoms for months and months and months that are still having fatigue, I covered this in a previous episode talking about, I think the episode was like headaches when reading or something, and also neurofatigue. So the reason, or one theory behind why that might be, is that you have two kind of brain networks that work one at a time. So for example, your default mode network, which is also known as the ego, is kind of your self-talk, is your, what am I going to do later today? Do I need to get groceries? Etc., etc. Just thinking things inside your thought, the random thoughts that you might have. It's also your ability to think into the future and plan things, and also think back into the past and remember things, right? So this is what they call the time travel, our ability to move back and forth, within our own mind and think of things. Then you have what's called your executive network. So when you're dialed in on a task and you're just focused on that task, you're using your executive network. Generally, those two networks, executive and default mode, don't work at the same time, right? When your executive network's on, your default mode network shuts off. And vice versa, when your default mode network kicks on and you're just daydreaming, you're not really focused on a task. You're kind of just in default mode network, right? And if anyone's ever driven anywhere and you get there and you've been driving for an hour and you go, I don't remember anything about that drive, because you're off in your default mode network, and the driving is kind of just taking care of itself automatically, right? So those two things, that's the thing. When one turns on, the other one shuts off, and vice versa. In people with concussion, they found, when they look at fMRI and they look at brain activation areas, they find that both of these networks are on at the same time. So when they give you a task and you're in the fMRI machine, in a normal healthy subject, the default mode network shuts off and you see activation of the executive network because they're performing a task. When you put somebody in with persistent concussion symptoms, their default mode network doesn't shut off. It stays active. So they perform more poorly on the task, but you're also using double brain power to try and achieve the same result, which is actually a lower result. So you're using twice as much energy to arrive at a shittier result, is essentially how that works. So that is one theory behind why you might be fatigued in the chronic state. Going back to some of the stuff that I talked about in that episode, I go into a full thing on it in that episode, so I would encourage you to go back and find that. I don't know what number it was. Was it 50?
I think it was 50, yeah.
It might have been 50, episode 50. If you just go back and listen to that, we do a full explanation for this. The interesting thing about that, it is not just people with concussion that have this problem. It's people with generalized anxiety disorder, people with post-traumatic stress disorder, people with chronic stress. All of these things can make it so that your default mode network doesn't shut off and your executive network, when your executive network's working. So when you have something that's going on that's anxiety provoking, I just told you some news about my daughter. I'm having a difficult time trying to stay on track because it keeps creeping into my head of this other thought. So that's what anxiety does to you. It makes your performance suffer, and it's a lot more taxing to try and coordinate multiple thoughts at the same time. This is what people with concussion go through, but it's also something that's anxiety related. And this is the role that mental health plays in persistent concussion symptoms. The whole idea behind a lot of mental health therapies is to quiet the default mode network. Because if you can shut off, or at least make the self-talk reduced when you're performing tasks, you'll burn less energy and you'll perform better on those tasks. So anyone who's currently having neurofatigue and wondering why and not performing well cognitively, oh, I can't focus when I try to do work, I can't focus when I try to read books, all of that stuff, you need to take a look at the mental health side, okay? There's anxiety, there's depression, there's thoughts that are creeping in that are distracting you from what you're trying to do on the executive network, and then you're burning more energy and you end up with neurofatigue. I do a full explanation of this on episode 50. I'm not going to go into it again, but go back and check it out. And please, everyone, keep in mind the mental health aspect of persistent concussion symptoms. All right? If you can control the anxiety and control the depression symptoms and reduce the self-talk and quiet the mind, this is where meditation becomes helpful. Mindfulness, all of these things can help you to recover from your concussion, have less fatigue, and better cognitive results. Okay? So those are the two things. Acute, you've got energy deficit. The energy deficit recovers. So after a month, it's no longer related to energy deficit, right? So it's not I have a brain injury, my energy levels are low, that's why I have so much fatigue. It's something else that starts creeping up, and generally it's the default mode network, and they call it default mode interference because it's interfering with your shit. Okay? That's why.